So here is another idea about how to maintain or keep alive more patients than officially we are currently capable. We can create or convert a dialysis machine into a reverse oxygen dialysis machine to enrich the bloodstream, and we can use the ventilators as well. So in UFC and maybe other sports, it is forbidden for oxygen enriched blood transfusions, but high altitude training and compression tanks are allowed. So the technology exists for enriching the bloodstream artificially, but I don't know how much of it is available and who has it. And this takes me to yet another possible solution to save more lives if there are available blood transfusion machines with oxygen enriching capabilities, like a reverse dialyser or a reverse dialysis machine, or the same stuff they use in UFC. So in the same manner, the dialysis patient has its urine removed from its bloodstream, an athlete can have their blood enriched with oxygen. Apparently, the lack of oxygen in the bloodstream is the #1 cause of death on COVID-19 patients. And that is because the organs cannot be supplied with the precious oxygen. A blood enriching oxygen machine may supply the patient's bloodstream with oxygen to bridge them through the worst stage of the recovery. In this manner, the internal organs, the brain, and the heart can receive the precious oxygen. Apparently, most COVID-19 patients die because the lungs themselves cannot transfer the oxygen into the bloodstream. So we can still use ventilators and more patients per ventilators if that works, just to pump the lungs, not necessarily to transfer the oxygen and maintain the lung elasticity, but we can supply the patients with oxygen through the bloodstream. I know there are methods for enriching the bloodstream with oxygen to blood transfusion. And I also think the ventilators are a bad idea because they use the defective means, the affected means, the lungs themselves, to transfer oxygen into the bloodstream. So the ventilator pumps the lungs, but the lungs do not have the capacity of transferring the oxygen into the blood, and the organs don't receive the oxygen, and usually the heart kind of starts getting tired and so on and so forth. But if we circumvent the lungs with a reverse oxygen dialysis machine to enrich the bloodstream, and we use the ventilator as well, then the patients may be able to stay alive through the worst stages of the disease until the lungs regain the capacity to transfer the oxygen in the bloodstream. In addition, if we pump an excess of oxygen in the bloodstream, we can rotate the patients to these machines and keep them alive more while the worst stages fade away. This may yet be another solution to this problem in this dire situation. Another idea may be that if there is a special filter to clean the bloodstream, to kind of filter out the blood specifically of the virus to prevent its rampant ability to multiply in the bloodstream and probably regain at the same time the oxygen enriching happens to allow the lungs to regain some of their capacity, that would be great. Now, this filter idea may be light years away, and I don't know that. That's just another idea. But I know the oxygen enriching technology exists. So maybe we can quickly reverse dialysis machines into oxygen delivering machines directly into the bloodstream. And for the healthy ones out there, I hope you're washing your hands and keep safe. But I heard that gargling a mixture of lots of salt with lemon and water may help clear the virus from being transferred from the throat into the lungs. So I do not know if this is true, but I'm just sharing it because it cannot hurt. So please share this idea with whomever you can. Maybe there are brilliant people who can use this and convert these machines or make them quickly. But until then, I bid mon amis much health and safety and clear skies on this dark period.